I had the privilege actually of starting this program in 2012, and I can tell you that I have been lucky enough to be able to somehow attract the best and the brightest and the greatest group of motivated applicants that any program director can hope for. I hope as you're watching this video and you meet our residents and you look around that you find something that interests you. And rather than sit here and tell you how special we are, I'd much rather that our residents demonstrate that for you and that you come to a decision that shows you that you can get and fulfill all of your professional goals right here at Hofstra Northwell.
I knew that coming to Northwell, I was going to be provided with an extremely diverse patient population. And in my opinion, I think New York is one of the best places to train for residency.
I believe one of the advantages of training here is that we have two home hospitals, one of them being Long Island Jewish and the other one being at North Shore Manhasset. Long Island Jewish is connected to Cohen's Children's Hospital, which is a level 1 pediatric trauma center, while North Shore Manhasset is a level 1 trauma center for adults. Long Island Jewish is in Queens, which is one of the most diverse boroughs that you have.
Every year we've been tweaking the internship, adding some rotations, taking some away to really make our first year of residency really tailored toward what we're going to be doing in our later years of residency, our anesthesia years.
One of the reasons that I really enjoy this place is that you can definitely feel that there's a culture of respect here amongst all the members of the staff, all the team. There's a lot of teaching that goes on and everybody is really here to support each other, and you get a lot out of that, I feel.
Some of our medical ICU attendings are really prominent in the world of critical care ultrasound, so we learn directly from them, learning ultrasound for both vascular access and point of care ultrasound at the bedside that we can later use in our anesthesia years.
So I think our sim experience is good for two reasons. One is that all the attendings that do the sim with us are very passionate about it. They really want to be there and they're really involved with that whole process from designing it from beginning to end. And I think that having seen all the scenarios that you see, especially early CA1 year, it really prepares you for a lot of possible difficult scenarios you see in the OR, having done them and seen them before.
Another thing that we added was an ENT rotation. So basically we work in the office of one of our ENT surgeons, just learning how to do fiber optic exams, become comfortable with doing fiber optic exams, just really be comfortable with the equipment, which is again something that's really beneficial when we start our anesthesia training.
One of the great things that our research month offers us is the ability to get on board projects from early on so that we have ongoing things throughout the duration of our program. And hand in hand with research is our ability to go to conferences. Our program director has been sending the CA1 residents to the ASA conference every year, which has been a great opportunity. And the rule is if you have a submission and you get accepted, you get to go. So that's really unlimited. And I've taken advantage of that over the years.
I felt like I gelled well with the residents here. I felt very welcomed. I didn't feel out of place. And I couldn't be happier with my decision. So.